Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. Everybody loves free stuff, so I have a couple of free things to announce. First, for the first time ever, we are offering a $995 boot camp for free. It's March 14th, 15th, and 16th, 3 hours each night. You're going to spend with me and some guest speakers you've never heard from about topics that we've never discussed before, some familiar, but some things that we've not brought to the table for the general public before. And I promise you'll enjoy it. You will leave energized at the end of the last session and ready to really dig in and take your health to a different level. I'm still taking my health to a different level. I've been at this for 30 some years. I clean things up, I tweak things, I add things. I've been taking Dr. Mila's vision class, and I've added her daily exercises to what I'm doing. And so there's always more to do, better to achieve, right? We're going to help you do it. The other thing is I've been announcing we were opening a clinic. We did. Our nurse practitioner started seeing patients last week, and we're having a reception for her at 2 p.m. at our office on Saturday. She'll be giving a little health talk, Q&A. I'll be there. We're going to serve some free refreshments. And so if you're driving distance in Columbus or an Ohio resident who's looking for a healthcare provider that doesn't entail all the garbage that we all want to get away from, then you want to come and join us and meet Randy Weininger. All right. So you do need to RSVP for both of these things, for the boot camp and the meet the nurse practitioner. So we know we have enough food and that sort of thing when you come. And for the boot camp, because it's first come, first served. And as you guys know, Zoom has a limit to how many people you can have in these sessions. It's not unlimited. So the response has been really good. So let us know, Pam Popper at msn.com, if you're going to join one or both of these events. So I'm going to start today. I have two topics to cover. And the first one is going to be an answer to a question from a viewer. This person writes that she has recently changed her diet to one that's lower in fat and higher in fiber, more plant-based. And the reason she did it was to feel better and get better. But instead, she says her gastrointestinal system is screaming at her. She has gas and cramping and even some constipation. Why could this be happening? Are some people just not supposed to be plant eaters? Well, here is my answer. First, humans are designed to be plant eaters. We've always been plant eaters. For those of you who will be joining us for the boot camp, I'm going to present a very short history of humans and their relationship to food, which I think you'll find very interesting and goes to this point. But for a more direct answer to our viewer here, the discomfort has to do with the gut microbiome, which breaks down constituents in food like fiber and makes nutrients and anti-inflammatory substances like butyrate. What we eat plays a major role in the composition of our microbiome, which in turn plays a major role in the way we digest food. For example, diets high in protein and fat use different pathways and different bacteria for digestion than diets higher in carbohydrate, fiber, and plant foods. When you change your diet, including when you adopt a better diet, it's important to remember that your gut bugs may be encountering foods that they haven't yet encountered much of. A new diet begins to shift the microbiome and can lead to changing intestinal motility and even a little inflammation temporarily, causing discomfort as new constituents and microbes begin interacting with the existing microbiome. The good news is that this is temporary. Research shows that within a fairly short period of time, a few weeks, the microbiome starts adapting to the new diet. Increases in beneficial bacteria, decreases in pathogens occur in response to the new diet, and things settle down. A good probiotic can often speed things up and might even be necessary if a person's microbiome's been damaged with drugs like antibiotics or steroid drugs, or has eaten a really bad diet for a long, long time. The bottom line is GI distress is not a sign that the new diet is bad, but rather a sign that the prior diet was probably not so good and the pathogens that are being starved out are not so happy with you right now. One other thing I want to announce before we get to talking a little bit about cancer treatment is I teach a research and writing course once a year. It's an 8-module course that always starts in February and ends in September. There's an assignment in between each class that gets more difficult as the time goes on. I provide a lot of individual feedback, and the goal is to get better and better at researching and creating content and information, or just analyzing for your own personal benefit. Some people to say they have PTSD at the end of taking that course, which makes me very happy. And the reason I say that is not because I like for people to be miserable, but because learning how to shift your thinking and how you observe things and how you look into things is difficult. It's difficult for providers, it's difficult for consumers, but I think getting to the truth of things is something that we're all interested in, and this is what this course will help you with. So if you're interested in that, send me an email, pampopper@msn.com. Now, we talked about diet before, better diet. Here's some more incentive to adopt a better diet to prevent cancer. And the reason is cancer treatments are not as effective as many people think. We see this every day as we help cancer patients evaluate information that's been given to them by oncologists, where as they look at the medical literature, much in the way that I teach people in the research and writing class, they say things like, I'm 50 years old, and this cancer treatment was told to me that it would extend my life by 50%, but my life expectancy is less than 5 years. I can't do this as a sole treatment because that's not what I'm looking for. Well, a new study reviewed claims reimbursement data to evaluate evidence of improvement in overall survival and quality of life for cancer drugs. And the reason for this review was that in many cases, cancer drugs and others, by the way, are approved because trials show improvement in surrogate markers like tumor size or blood markers, but there's no evidence of better quality of life or long-term outcomes. As I just described, sometimes increasing survival by 50% doesn't really mean very much, and quality of life is almost non-existent. So data was reviewed for 40 trials covering 22 drugs used to treat 9 cancers that included renal cell carcinoma, Hodgkin's lymphoma, chronic lymphocytic leukemia, chronic myeloid leukemia, melanoma, non-small lung cancer, breast cancer, ovarian fallopian cancer, and medullary thyroid cancer. Only 7 of the 22 drug indications had at least one trial showing conclusive evidence that overall survival was improved. The other 15 either lacked data from randomized controlled trials or showed no statistically significant improvement. Only one drug was effective for improving overall survival and quality of life. According to lead author Gabriela Chukastrand, quote, we have shown that the majority of drugs launched with limited evidence still lack clear evidence of how they actually affect survival and quality of life in patients. Now, something I think is important to understand, at least here in the United States, is that drugs are often approved with the drug company promising the FDA, for example, that it will conduct additional trials and report back results from those trials so that the FDA can then reconsider whether or not the drug should stay on the market. It doesn't happen most of the time. There's no accountability. The drug companies aren't punished in any way for not doing it. And I can't remember the last time I checked, it was some ridiculous amount, like 85% of these drugs that were improved with inadequate data. No follow-up data was ever submitted. So anyway, back to Dr. Strand, who was the lead author. She says this creates uncertainty about how these drugs actually contribute to meaningful patient benefit, no kidding, and ultimately how effectively resources are being used within healthcare. Well, let's talk about resources in healthcare. I've been speaking out a lot about this recently. In 2020, over 18 million people were diagnosed with cancer worldwide. All right. The cost of treatment for just the 15 leading cancers in the US alone was over $156 billion in 2018. And this data set only included privately insured patients under age 65. We are spending a lot of money on treatments with limited efficacy. And by the way, this is why I have said again and again, and some of you don't like it, but I'm going to say it again, there's no possible way we can build this healthcare company unless we have trained consumers and trained providers who understand this type of thing so that we don't just bankrupt ourselves because the government's paying for a lot of this. It's all subsidized and we won't have those kinds of subsidies. Well, some takeaways from this that you should remember. First, cancer is a largely preventable disease. I will tell you that during my 28-year career in healthcare, I've only seen a dozen or so cases of cancer which could be written off to bad luck. It's terrible, but sometimes bad things do happen to very good and often healthy people. The rest of the cancer cases have been directly linked to things like weight status or alcohol or drug use, poor diets, lack of exercise, prescription drug use, or treatment for other conditions. And a good example would be autoimmune disease. Patients are often treated with immunosuppressant drugs, which makes them more likely to develop all kinds of things, including cancer, and then stress and lifestyle factors. So all of these things I just mentioned are modifiable risk factors, including even immunosuppressant drugs for autoimmune. Those can often be discontinued if people adopt the right strategies. So a couple things I'll recommend. Remember that membership includes a lot of training, access to some of our libraries or all of our libraries, depending on the type of membership that you buy. The boot camp will talk about some of these things in more detail. We have a cancer concierge program for people who are dealing with making difficult decisions about cancer that you might want to consider. And that's access to dozens and dozens and dozens of videos and slide sets and referenced articles and instruction on how to look at treatment options and understand what everything says, that sort of thing. And then you might want to start a food over medicine club and help gather up people to learn how to eat in a better way and enjoy healthy food. So if you're interested in that, we have some real special offers for the first people who start a club, and also for the next 20 or so health professionals who sign up to train with us because they want to join our healthcare network. So my email address is pampopper@msn.com. If you're interested in any of the things that I've been talking about or other things that I didn't, please send me an email. We'd love to help you with your health, help you start something in your community, help you get out of conventional healthcare and into something better. I think what we're creating is something better. Very excited about it. So that's it. That's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.